Americans understand that sexually transmitted infections can be silent, many still delay testing, even when symptoms appear. Joining me now to explain is Chief Medical Officer for HealthTrack RX, Dr. Stephen Goldberg. Dr. Goldberg, always a pleasure to have you on Bloom.
Good to be with you, Amber.
Okay, so let's get right to it. What were the findings in this study conducted by HealthTrack RX, and what stood out to you the most?
The main finding is that people are delaying care for sexually transmitted infections, and that can be dangerous for them and their partner. So the study helps us understand what the factors are to that delay. Oftentimes, sexually transmitted infections can have no symptoms. Oftentimes, they can be vague. And often people have embarrassment or shame. And finally, they'll come in, it seems, if they get a prompt diagnosis. So all of those are key considerations.
So why do you think this is happening? Why are people not getting tested right away?
As I said, there are a number of different factors. Half the time, someone could have an STI and not know it. Oftentimes, the symptoms can be vague. Other times, they don't have good access. Other times, they feel embarrassed or shameful about coming in. What's clear is that if they get prompt diagnosis, such as next morning results, and get specific treatment, they're going to get better and prevent spread to a partner.
Which is ultimately what we want, because you're not only potentially harming yourself, but you're harming other people in the process and may not even know that you're doing it. You found that a lot of people aren't going to a doctor first. They're going to Dr. Google and going online. How do you think that's changing things?
Yeah, that's a very interesting point. Many people go to Google for first information and not to a clinician. I'm all about getting an understanding about your condition, but what we also see is that information can be inaccurate, and it can also delay diagnosis and make things worse at the time someone actually presents. So what I would suggest is specifically for a sexually transmitted infection, if someone has symptoms or concern, get right into a clinician, get an evaluation, including next morning results, know exactly what's going on, and get specific treatment.
Because this really comes down to behavior needing to change. So how do you think we actually get people to get in there and take action?
Well, we have to make a visit comfortable for people. We have to get rid of the stigma of coming in about a sexual health question. We have to be able to use diagnostics that are highly accurate and get results the next morning. And then we have to let them know the dangers of delayed care, which can include pain, infertility, extension of infection. So all of those are considerations, but the bottom line is people will come in if you address all those issues.
It really can be dangerous, and you make some really great points. Thank you so much for being here. It's so important that we get this information out there.
You bet. Our pleasure.
Well, you can ask your doctor about fast, accurate STI testing and learn more at healthtrackrx.com. Stay with us. Bloom will be right back.